Right, so today we have Wolf Kirsten, Tommy Hutchinson, and John Kamola. And Michael, we have a little bit of an echo.
Oh, I wasn't hearing the echo. You sounded okay.
Oh, I'm hearing it on my end. Anyways, continuing on.
Okay, well, I will totally cut that part out. So.
Okay. Wolf is the founder and president of the International Health Consulting based in Tucson, Arizona and Hamburg, Germany. His consulting portfolio is truly global, advising companies on health and well-being strategies such as Johnson & Johnson, IBM, Siemens, and SAP in many regions of the world. He is currently the president of the International Association of Worksite Health Promotion and a co-host of the Global Healthy Workplace Awards. Tommy Hutchinson is the founder and CEO of iGenius. iGenius is a world community of social entrepreneurs with over 200 countries involved. Tommy began his career in student politics in the National Union of Students, where he headed the international section and created the first East-West European student organization. Tommy then went on to work in the City of London for 10 years and has been everything from an aerospace analyst to a political advisor to NatWest. He also headed the Industry Forum, which brings together over 200 companies collaborating and engaging with governments. Around 2002, Tommy helped create a youth charity and continued to work on a number of different projects in different areas, from marketing events, Peace in Ireland, to a magazine for the European Union. John Kamola is the founder of the Global Knowledge Exchange Network on Health. John is a highly motivated professional with extensive experience in healthcare and public policy and the private marketplace. He has a broad global network that reaches into many business sectors: health insurance, Fortune 100 employers, pharmaceutical manufacturing, federal and state government, hospital, physician associations, public health associations, advocacy, and consumer groups. He is well recognized as a public policy catalyst, having made significant contributions in U.S. healthcare public policy. He is a frequent speaker and facilitator in the national and international venues. He has co-authored a dozen books on different topics related to healthcare administration and delivery improvement, and we're going to kick it off today with Wolf Kirsten. Wolf?
Thanks, Kelly. Well, hopefully the audio is fine and we have no echo. So hello to everybody. I know that for some of you it's pretty late in the day, as calling in from far away. So again, thanks a lot for joining and to learn more about the Global Healthy Workplace Awards. So basically, this slide really shows what we want to talk about today. And this our second year of the Global Awards, and the Global Awards Summit will be held next year in Shanghai, China, in April. We would like to, I would say, like twofold. Our goals are twofold. One is to really explain what are the Global Awards, what are we all about, and secondly, kind of specifically outline the process and the underlying criteria. I know that some of you, or quite a few of you actually online here, are interested in applying for the awards, so that hopefully that you, in addition to all the information that is on the website that you see here, that in addition to that, you know what exactly to do, and give you ample opportunity to ask questions after our brief presentation. So I think that's really important that you have that chance, and so you feel well versed to apply. And as you can see here, the deadline is on January 24, so there is plenty of time. But as you know, we have some holidays in between, so it doesn't it's not that far off. But for now, I'll hand it over to John Kamola, and he's going to give you an intro, and after that, Tommy, and then I'll come back to speak more about the criteria. John, I'm going to forward it to the third slide. I don't know if you can see it now.
Thank you, Wolf. I appreciate that. Welcome, let me welcome all of you on the line, and thank you for participating in the webinar today. This is a very innovative program and one that had enjoyed a great deal of success in April in London in 2013, and again in Brazil, in São Paulo, where we held a regional summit. So we are talking today principally focused on where we're headed moving forward with Shanghai, as Wolf has said. The overview that we'll walk through today will share a little bit about the host and the partners that are involved in the program. We'll talk a little bit about our work at the regional level, as well as the global annual awards itself, and then get into the application criteria and details as we move through. And as we said earlier, we'll be leaving time toward the middle end of the call to answer your questions. Promoting a global healthy workplace. Promoting a global healthy workplace really is about celebrating workplace health and health promotion in general, both inside the workplace and as it relates to the community around the work site. The Global Employer Award recognizes large, medium, and small employers. The summit itself is content-laden with perspectives from around the globe, so that we truly have a global focus on this initiative. The content, we have a new website, globalhealthyworkplace.com, which you can go to and learn more detail about the awards themselves, our regional summits, and our work. So we're really about sharing better practices and doing that in a way that allows all employers to recognize the successes of their brethren from around the globe. Finally, let me talk a little bit about good health equals good business. The model that you see in this slide is really focused on work that the World Health Organization had undertaken to create a format or standard for recognizing and promoting workplace health. As I mentioned earlier, there are three categories, and both for the award, and they track the three categories in the model itself. So the categories are large enterprises, small and medium enterprises, and multinational enterprises. The model itself has a continuous improvement cycle that moves through all elements of the model, and Wolf will go into greater detail about these when he presents. But I want to highlight the four large areas. One is the physical working environment, psychosocial working environment, personal health resources, and enterprise community involvement. And finally, before I hand it over to Tommy, I want to point out some of the folks involved in the initiative. Our hosting partners, as was articulated at the front end of the call, are hosted by three organizations: the Global Knowledge Exchange Network, International Health Consulting, and iGenius. At the onset of this initiative, we assembled a world-class advisory board made up of the International Association of Worksite Health Promotion, the International Organization of Employers, the International Institute for Health Promotion, American University, the Health and Research Organization, HERO, and People in Aid. Thank you very much. And Tommy, I'll hand it over to you now.
Thank you, John, and I hope everyone can hear me okay. John, there was a little bit of echo in your presentation, so it might have been difficult for some people, but I hope most people were able to follow what you were saying. My name is Tommy Hutchinson, CEO of iGenius, and I'm based in London. And this is Wolf is Germany, from Germany, and also in Tucson, Arizona. And John, as you may have gathered by his wonderful accent, is from Austin, Texas. So we, the inaugural summit took place in London in April of this year. We had 150 participants, and that was quite a very deliberate number. We've it is our intention for these awards to be, or the summit that we host, to be large enough to make it a good event for people to meet lots of a good diverse audience and diverse network, but also not too big, because we really want to kind of an intimate gathering of people so that we can really have a good sharing of information. If you're able to see this slide, which I hope you are, you will be able to see the most of the organizations that participated in London. They vary from Abbott to BP, Bupa, Dow Chemicals, also some universities like Heidelberg and from Colorado, and also the World Health Organization, Vodafone from Turkey, and so on. We also had Shell and a number of other interesting companies. So we've got a good diverse of corporates, academia, NGOs, and also some kind of more journalists and policymaker types. So I can hear an echo, at least of myself, but I hope it's not as bad for you. I'll go on now to the next slide. And here we have the winners and the finalists for the 3 categories of awards that we had last time. So we had Alexandria won the Alexandria Health, which is based in Singapore, won the large employers, and the runner-up was Johnson & Johnson. Toyal America was winner of the SME Award, with Technica International from the Lebanon was runner-up. And also Royal Dutch Shell won the Specialized Program, and American Express was the runner-up in that one. The categories for the coming awards are Large Employer, SME, which is any business up to 500 employees, and also then a category for multinational programs. So, and we developed that new one on the basis of the feedback that we had from the last session. The next slide, and I think, yep, here we are. So it's very important to us that this is in effect almost like a campaign to spread the word about the importance of healthy workplace. And I think one of the things that we clearly demonstrated in London is that employers that look after their employees, both their health and their wellness, will almost certainly in most cases improve the productivity of their organization. So the kind of the broad strapline of the program is good health equals good business. We pushed that message out very heavily amongst media organizations, and we had a really diverse range of coverage from CNBC, Wall Street Journal, the Independent newspaper in the UK, some specialized networks like MSME, which is a website for small, medium-sized enterprises, and so on. Social media plays a very important part of the work that we do, and we estimate that in the last summit we got to over 2 million via Facebook, Twitter, LinkedIn, YouTube, etc. And we also send out newsletters which go to many people, many thousands of people, and I hope that you have received a newsletter. But if not, please let us know, and we can make sure that you're kept up to date. The next slide. So the program really is based on one summit each year, so London and Shanghai being next, and also regional seminars. And we've had our first regional seminar, which was in September in São Paulo. And the next, and here we have, if you're able to see the slide, a breakdown of what occurred at that summit. And it was in connection with with the organization based there, headed by Alberto. And we also were able to show the results of the Buck survey and various other content. This event was primarily geared to an audience in South America, and we did it alongside the ABQV Congress, which took place immediately after our seminar. But and basically, the seminars we look at areas that we can dig deeper. That the summit covers a fairly general, broad series of areas, and then the seminars go into more detail in a particular either issue or a locality. And the next slide, and then these are the dates for Shanghai. And please let us know if you're interested in attending. Places will be limited, so but we'll try and incorporate and we'll try and accommodate as many people as we can. So I think, just checking on my schedule at the moment, I think I might now hand over to Wolf. Is that correct, Wolf?
Yeah, that's correct, definitely. Thanks, Tommy. And Michael, let us know if the echo is too bad. Once in a while I hear an echo, once in a while I don't. So hopefully for everybody out there, the audio is not too bad. And make sure, I know, John, you have muted your microphone. Tommy, if you do the same, then I think that will help. I just wanted to, moving on, I wanted to underline what both Tommy and John already alluded to, is that with this awards program, first of all, the really big distinction is it's truly global, and I don't think that exists anywhere else. As you know, there's quite a few national or maybe even regional awards programs out there, but none are truly global. So I think that's important to point out, and also that we are all about creating a learning platform, sharing and learning platform, which is there to stay for a long time. It's not all about just an award and the companies get a photo op and go home. So we're really about creating that platform of good practices or better practices, if you will, which companies, workplaces can learn from globally, anywhere in the world, and hopefully can replicate at least parts of it. As you know, it's not always that easy to replicate programs in one workplace or one city to another, but I think there's definitely things that we can learn from each other, as you probably all agree, and that's what we want to do on a truly global basis. So it's really not just about North America and Europe. It's Asia, it's South America, it's Africa as well. And so that's what I wanted to drive home that point. Okay, now getting into the actual process and the application. Tommy already outlined the three categories. I'll just briefly repeat them so you know. SMEs, small and medium-sized enterprises, so any companies which have less than 500 employees. Large enterprises, anything above that, above 500 employees. So, you know, a company with 600 employees may be still considered small, but we obviously have to draw the line somewhere, and that's one of the established or recognized caps of employees, so to say, is at 500. And then we have created this, for this year, this new category, multinational enterprises, and basically employers which have employees in different countries and who work, you know, across multiple worksite locations and countries. And that kind of is different from the large enterprise. It really is only on one local site. So if you are a multinational enterprise, you actually have the option to apply to either. So maybe your, let's say your Australian worksite in Melbourne or somewhere, it's a very good program, and if you feel they have a chance, you can apply to large enterprises. But if at the same time you have a truly global program, which, you know, spans across the globe, you can apply for the multinational enterprise category at the same time. You know, so because they are two distinct, different entities, basically, who are applying. So that is possible. We of course are interested in getting as many good applications, I would say, worthy applications in all three categories, and sometimes with SMEs that's challenging to get the word out, but I think we had a good start this year, and we're working on getting more applications and working with some of the professional organizations out there, international organizations, which basically represent these enterprises. For example, like the here in the U.S., the U.S. Chambers of Commerce. So I'm very glad that they're going to be supporting us in this effort. So the criteria, which is maybe the most important thing of all, is really the WHO, World Health Organization, Healthy Workplace framework, or model, if you will, as you can see here on the slide, and which John already alluded to. Well, why this model? Well, first of all, the World Health Organization, is probably the most, established and recognized authority in terms of health globally. And secondly, because we really believe this is a truly comprehensive, integrated model which covers the aspects and needs of health in terms of employee health at the workplace. So it's really about these four main areas. The physical work environment, which kind of looks at your your health and safety concerns, which a lot of companies have a pretty good grip on, but there's always challenges, and in some countries there are some glaring gaps and challenges, I think. So that's more around your occupational health. Then on the right side, the personal health resources, they really that alludes to or covers your more traditional wellness programs, healthy nutrition, physical activity, all those things which are very important and which a lot of companies are doing a good job at. But it's beyond that. If you go all the way over to the left, we also think it's important, or WHO I should say, to address the psychosocial work environment. So how is the psychosocial atmosphere at work, or are there any risks? So let's say your leadership, your boss is abusive. It could be harassment. It could be the relationship to your colleagues. It could be that demands are so high on you and you have so little resources to actually fulfill these demands at your workplace that it's making you sick. It's making you ill. And there's plenty of research in this area which shows these kinds of situations which actually lead to heart disease, cancer, all of these things. So it's not just your traditional physical work environment, what you breathe in. We've all been in this situation, right? I mean, it's about the atmosphere at work, the environment. This, for lack of a better word, it is the psychosocial work environment, and that impacts your health. So it's very important. And actually, there's now legislation in a number of countries, and employers who are not aware of that should be. There's legislation in a number of countries which actually demand or require employers to analyze the psychosocial risks, to do a risk assessment. Just like you need to do a risk assessment with your air or noise or whatever, or chemicals, you need to do this in this area too. So that's very important. And traditionally, or not traditionally, but typically we've seen in our first year, and I think in some other areas too, that this area, the psychosocial one, I should say, is a weakness for a lot of companies. So maybe no surprise, because it's still kind of new in terms of being illuminated or being discussed. But I think that's very important. The fourth one is called the enterprise community involvement. For some larger corporations known as corporate social responsibility, for many reasons, I won't go into these now, but the WHO doesn't really like the term CSR, corporate social responsibility, but that's pretty much what it is. In terms of ways of participating in the community. I get an echo again now, I'm not sure why. Thank you for muting. Ways of participating in the community to improve the health of workers, their families, and other members of the community. Sometimes employers provide, health care, not just for their employees, but also for the families, and give a chance also for the wider community to get involved. So it's not always about going into Africa and building a well, where that kind of stereotypical thing. It's really about the community that you're in and how you can involve them and help them on a larger scale. So it is, it may seem daunting. I think it's a large area, large 4 areas, but a lot of companies are working towards this, and there's no company which is obviously perfect in all these 4 areas, but we do want to make it clear that these are the underlying criteria. So even if you feel you're kind of weak in one area, you can still apply. Obviously, it's a competitive process, and maybe other companies have similar challenges, and you still have a good chance to win the award. You should, however, have recognized that there are 4 areas, and that you are willing or planning to work towards them if you feel that one area is not as strong as the other. So that should be expressed in some way or the other. And then I should, of course, explain the center of this model. And it's really, most of you will be familiar with this. This is really about a continual improvement process. Like PDCA, some people know it as such. That you need to assess. Well, first of all, mobilize, assemble, but then assess. You need to assess the needs. I think most of us have learned that somewhere along our education. Prioritize, plan, do, and then evaluate. And from the global survey, from Buck Consultants, the global survey on health promotion, we see that only 30-some%, I think it was, evaluate their programs. And these are companies which are probably on the more progressive side in terms of health promotion at the workplace. So there's a gap. There's a big gap. Companies do not evaluate their programs, and we really want to drive home that point. I think an employer which has not evaluated their programs and has no plan to do so, they won't win the award. I think that's pretty clear. So that needs to come out in the evaluation as well, to make that clear. But let me move on. I'll touch upon some of these again when we get into the application. But for the sake of time, I want to move on here. These are, just so you know, these are our 5 judges. These will be the individuals who will be looking at the applications. And as you can see, it's truly global. We really want to drive home that point that we have a good representation and from countries and cultures. So from Europe to North America, Asia Pacific, South America, and Africa. You maybe could say we want to be truly global. Where's Australia? Well, we're working on that, but we obviously want to keep it manageable too in terms of the jury. But we're very glad to have these 5 distinguished individuals. Some of you may know them as part of our initiative, and they've been very very active and very helpful in getting this going. So this basically reflects the model that I just explained. The WHO, the World Health Organization, in addition to their Healthy Workplace model, they developed a document called the 5 Keys. So to a large part, our criteria, the global awards criteria, are based on those 5 keys. Not one-to-one, but very close. Because again, we believe that this model is the best out there at the moment on an international scale. I should add that the bottom 2 items here, innovative and replicable, are very important. We really place a high value on that as well. That there is an element of innovation within the program. So a program which can show that and document it. Would score higher. Would definitely score higher, because innovation, is something, as we all know, we strive to, in which some sectors, like the technology sector, does a good job of. Like the Apples and the Googles of the world. So that's definitely one element that we look at, or the judges look at. And then this issue of replicable, being replicable. That goes back to the essence of the entire initiative. That other workplaces, individuals, experts learn. They learn from this. That they can take a look, whether it's through the website, whether it is through one of the regional seminars or summits, and try to take it home and make it work in their own environment. Again, it won't be always that easy, but if they don't learn, if they don't have the opportunity to learn, they will never have the chance to do so. So I think that's really important, that it's not something so specific, only towards your industry, the strategy of the program, but it really kind of can go across, or can be implemented across sectors. So if you can make that clear, I think that will also be considered significantly in the overall score. Now, so you see these 7 different areas, and the questions basically that you will see now, I'll run through them relatively quickly, but the questions that you see here are basically related to those 7, I guess, headings: leadership, commitment, and engagement. I didn't specifically outline that. Maybe I should have in the model. It's right in the center. Both, worker involvement and leadership commitment and engagement is very important. And I think most of you will agree with that. And there's plenty of research out there which show, without a committed leadership, programs will not be sustainable. So how is the organization supporting, implementing, promoting the Healthy Workplace program? What role does senior staff play, or do you have a dedicated business policy? I think that's very important. Do you have a committee, a dedicated committee to promote a healthy workplace? And how are these activities integrated? The typical challenge companies face: HR, health services, medical, not talking to each other, working side by side, and then you may have another element somewhere, diversity or work-life balance in the bigger companies. So that's the integration part is important too, so that you really have it established at a fairly high level within the company. And I should say that this is actually a lot easier to do with an SME than with a large company. In a small company, if your leader is committed, you can get a lot done, pretty quickly. So that's actually a strength of an SME, of a small medium-sized enterprise, because very often people think SMEs, they're always at a disadvantage because they don't have the resources. Well, this is an advantage, I think. Okay, moving on. Worker involvement. That's the other one right at the center of the model. This is very important on a global scale, I should say. The interests of the workers definitely need to be considered from the get-go. And that doesn't always come out that clear. I should say that it's probably a cultural difference here between Europe and the US, not to mention the other regions of the world, but that here it doesn't always come out very clearly at the beginning. In Europe, in terms of the tripartite model, it's very high, very high significance. So and also the WHO places high value on this. So how are workers involved in the planning and the programming process beyond just participating? And also how does it promote diversity and gender equality? Also very important. Both of those very important issues. And some companies have done great stuff and have come a long way in terms of both diversity and gender equality. But I should say again, the WHO and a number of other international organizations place a high value on this. So if you can make that clear in your application, very good, very important as well. Moving on, I mentioned the continuous improvement cycle. So outlining that is key in terms of especially assessment and evaluation. What have you done? And can you demonstrate or prove what you've achieved, outcomes, so milestones. I know not every program can do that clearly. You don't always have your ROI study like somebody like J&J, Johnson & Johnson have, but nevertheless, there are ways to evaluate your program. It doesn't have to be return on investment. And at a minimum, there should be a process outlined. If, let's say, your program is still relatively early, there should be a process outlined how you intend to measure if you don't have those results yet. Not everybody has the results yet, so I think that's important to point out. But it needs to be specified or listed. I should say that I should have said it in the beginning, but all of these questions under these headings, the word limit is 500 words. So this is basically an effort to make the whole process manageable for everybody, for the jury, for us, for the applicants too, because as you know, some applications for awards very lengthy and very complex and very difficult, like a high barrier. But that's a challenge at the same time, right? Putting all these things for one heading for these questions, as you see in this slide, to put it in 500 words, which is like a page, I guess. It is a challenge, and if you have 505 words, it's not like you're going to be disqualified. But we did have some applications, unfortunately, last year or earlier this year, which were way too lengthy, and they attached 70, 80 slides, and PDFs, and that can actually disqualify you. I mean, because that will not, nobody's going to look at that. So that's something we need to make clear from the get-go. So I just want to point that out. So I mentioned innovative, very straightforward question. in which aspects do you regard this initiative as innovative, and put that in 500 words. It's a qualitative question, obviously, and the judges will take a close look at that. Sustainable. How is this healthy workplace considered sustainable and promoting lasting health improvements? Because as you know, some programs really are short-lived, and then they're gone. They may have a good result in the first year or second year, but how do you ensure it's sustainable? So I think that's very important for this entire awards program. And then again, going towards how have you expanded the initiative to new settings beyond this original conception? I think that kind of shows to like growth and also sustainability within your organization. Finally, replicable. As I also highlighted earlier, how would you judge the ability for this initiative to be replicable beyond its current form? I think that's important. Can it be scaled, implemented in diverse environments? So, be different from your own environment. Is it transferable? I think that's very important, and goes back to the essence of our entire program. So hopefully I made it relatively clear. There are a number of basic requirements. I won't go through all of these. I should say a couple of few. But first of all, any organization can apply. So it doesn't have to be private or public or nonprofit. All of the above. Of course, the programs have to be based in the workplace, but we did receive some applications where they weren't. So I think that's important because it's about a healthy workplace. And then if you apply, you're asked to provide information. You're asked to share information on the website. So again, it goes back to this learning and sharing process. So you can't say, well, we're going to apply, but we're going to be very secretive and private. We're not going to share anything. So that is a condition to apply. I know there's obviously some limitations and privacy issues, and of course those are worked out. I understand that. Yeah, and then I made that point clear about the not using supporting materials, because we had an issue with that in the first go around. And then which we haven't mentioned at all yet, I think, which is kind of exciting, is that per category, 2 of the finalists, so it's actually 6 organizations, 6 companies will be invited to come to Shanghai and then present their case study. And the winner will not be determined beforehand. So actually on site, the winner will be determined. So we have kind of a dramatic ending to it, I think, so it makes it really exciting, and people have a chance to really give it their all and emphasize what their program is really about and why they should win. So I think that's another attractive part of the awards program. But I've talked a lot now, so hopefully I haven't talked too much. But I thought it was important to outline the process beyond just seeing it on the website. I know it's always better to actually have somebody talk about it. But I do want to give you the chance to ask questions, I think, at this point, to me, to John, or Tommy, on any of the above, whether it's the criteria, the process, or if it's on the awards in general. I would be glad, or we would be glad, to field those. So I'll hand it over to Michael, I think, at this point, to handle the Q&A part. Michael?
All right, I'm here. Thanks, Wolf. So just type your questions into the box, and we'll get through as many as we can. I think there's been a lot of questions about what the heck is up with the sound, and I apologize for that. Sometimes a wireless network will do that because it kind of comes and goes. But you do what you can, and technology is only good when it works. So how do you go about it? Do you go to the website? How do you go about even thinking about applying for this award?
Yes, you do. You go to the website. I think we listed it. We should have listed here on the last slide again. I apologize, but it was on a few slides. Global Healthy Workplace, all in one word.com, and it's very clear from there on where you have a button where you can apply, and it should take you through all the steps, and you fill it out online and submit it. And we've tried to make it as user friendly as possible. As you just said, there's always glitches, but I think we have a pretty good process now where companies, organizations can apply fairly straightforward.
Super. Is there like a checklist of things you're going to need to complete this? application?
Yes, there is. There is a checklist on the website with the application. Or I just want to not warn, but make clear that just checking. Some people or some companies think that just checking off the checklist is the application. It's not. The application is just. The checklist is just intended for you to see if you have those elements within your program or your company. But the application itself are those 6 or 7 areas, the questions that I listed, responding to those. That is the actual application which will be evaluated.
Okay. So let's see. Susanna wants to know, can they consult the application for winners of the last edition? I guess, can you see how other people filled it out? Is there a sample? Maybe I think is what she's asking.
We I don't think at this point we have a sample online.
Okay.
But I could look into that. You could look into that if we post one of them. I know, in spite of what I just said about the sharing, companies are pretty specific about what exactly is going to be posted online in terms of their own application. So we need to double check on that.
Yeah, well, even if you didn't name the company or anything, that probably would be helpful because, just personally, I know going to apply for things can be, looking at a form can just be daunting.
Tommy?
If I could just come in there, I think we've tried as best we can to design the the application form to be pretty user friendly. So I don't think anyone should find it too daunting. It's pretty clearly laid out. I hope it is. But if you have any difficulties with it, then I would request that you would email Jessica, Jessica, at globalhealthyworkplace.com. So if you've got any specific difficulties, Jessica's name is on the form. And if there's something that's maybe not clear to you, then by all means you can email her, and I think she would be happy to sort of help you through it.
Super.
Yeah, and at the same time, of course, you can contact any of us, one of us, at the same time. We're stand ready to answer questions. And if I may add one thing, I would if you're not familiar with the WHO Healthy Workplace Framework at all, take a look online. Again, you can go through our website to get to it, or you can type it in directly if you want on Google. Because it may be worth it. You may get a better idea of what the criteria or the healthy workplace is about if you want to take kind of a broader look. So just a tip.
Okay. Annette is wondering, could smaller offices, 100 to 200 people, of multinational orgs apply for the SME category? And she says, if the programs have been run without support from the head office.
That's a tricky one. That's a good question. I think we have to look at that on a case-by-case basis. But in general, if it's a contained program, and it's really it kind of has the essence of an SME environment, I think would definitely be open to that. But it's kind of a gray area. But I think it's a case-by-case basis. Yeah.
Sounds like a pretty unique work environment where, the employees have really taken the initiative to make that happen for themselves.
Yeah, I agree. I'd be interested to see that if there's really no linkage, because the M&Es, multinational enterprises I'm used to, they usually are interested in trying to standardize. But yeah, it'd be interesting to see.
Wolf, on that one, one of the criteria that the judges are looking for is kind of leadership of the awards program. So I think the judges would balance. Perhaps there is a very good program without top leadership. So I think that the judges would weigh it against against the expectation that there is leadership from the top. So I don't think we would exclude an entry without without the buy-in from the executive or the CEO or whatever. But it will almost certainly help the program if it has leadership from the top.
Yeah, good point, Tommy. Thanks.
Super. Now I wonder, this was just your first year of this. What, how did all this come about? What thought processes? Obviously, I think you're right that there aren't any others. And a lot of people, might have that thought, oh, we should do something, but it's obviously the rare person who actually sets it in motion. So, how did this start?
Well, I think the time was just right for it. And again, I think it goes back to the essence and the mission of DCAN, the Global Knowledge Exchange Network, to create this platform of learning and sharing better practices. And an awards program is a great vehicle to do that. Enterprises, companies, organizations have an interest in getting recognized, on a global basis, I think. And at the same time, the data gathered is fascinating. I mean, and again, we're not going to hide it. We're going to share with everybody, and that's really the key. I think that's where it comes down to. And the more I think we talked about it, both from many different sides, the corporate sector, the WHO, obviously, big interest in this, other NGOs. So a variety of sectors really signed on to this and were very interested, and so that kind of spurred us on to finally get it going, and we we're very open to continue to explore additional partnerships, from different regions. That obviously helps us in terms of making it better known and getting some different input on how to improve the process and all that. So yeah, I think it's kind of evolved naturally.
Well, and you almost transitioned into answering the next question I was going to ask, which is pretty intuitive of you. Where do you see this going? I think you mentioned before we came on that you have other ideas on how this can really expand and become really a super valuable entity. Can you talk any about that?
Yeah, sure, and John and Tommy at the same time, chime in if you want. I think that it's going to go beyond, and maybe I'm repeating myself, but that it's beyond a traditional conventional awards program, I would say, that we are well on our way of creating a global platform, sharing platform, learning platform for workplaces worldwide to learn how to create healthy workplaces. And we have big plans, and we're looking towards could be training, research. I mean, all those things which take a lot of work, but that's kind of the future. I think which we are working towards. And again, we don't want to duplicate anything, because there are in some areas, in some niche areas, there are great initiatives, and we try to bring them in, or we try to, I mean, just like with the IIHP, Michael, at American University, as you know, Bob Karsh, doing some great stuff, and he's on our advisory board, so we brought him in because he has this, really good network and academic strengths. So that's I think that's the direction we're moving to really create this kind of global center or initiative which workplaces worldwide can delve into to learn and improve their own programs. But Tommy or John, please compliment if you want.
Sorry, John, you were muted.
Can you hear me?
Yeah.
There we go. Thank you. This is John. I'll only add that I think part of what we're trying to do is larger than just having an annual award. And most of the things that we saw in the marketplace, as Wolf alluded to earlier, are one-off kinds of activities. And so we're trying to literally create an ongoing community and communication platform through newsletters, through these kinds of webinars, through not only the annual meeting, but also regional meetings like the one we held in Brazil. We believe that that's the best way in which to build a robust community thinking and talking about workplace health and wellness, and how to create that opportunity for cross-cultural learning.
Super. Well, I'm really interested in getting involved in this because I think it does seem to have a lot of really good stuff going on, and certainly a lot of people who are incredibly passionate about it. So if there's other people on the call who would also, maybe they are not in a position to apply for the award, but they would like to get involved, what would you suggest their first step would be?
Well, first step would be to take a good look at the website and see what kind of programs or information I should say are on there.
Mm-hmm.
And contact one of us three, and to see, to state your interests, which area you're working in, and how you may contribute to this global initiative, and then also attending one of our events. Whether Tommy was saying that the spots at the Global Summit are limited. That's true, but there are other events as well. I mean, like, we'll have a regional seminar in the Middle East. We'll have one in Europe, also in the U.S. So end of next year. So there are opportunities also to kind of be on site or do a face-to-face. But otherwise, virtually, I would say, just contact us and state your interest, and we'll go from there.
Well, sounds like
and if I may just add to that. Many of the participants will also know of other programs which may not be their own program, but they'll be aware of other organizations, large and small, that do very good health programs. And I think in the sort of with the approach of trying to spread the message as far as possible, we'd be very grateful if they could encourage other programs to enter for the awards, even if it's not one that you yourself are part of, because we are always looking for diversity and good quality programs. So we encourage all participants to please join us and help to spread the message out there.
Well, great. Well, Wolf, can you give me one more time, just to be sure, the URL, because it sounds like going to the website is really the natural best next step to see what all the possibilities are.
Yes, it's Global Healthy Workplace. Let me see if I can pull it up here. As you can see here, globalhealthyworkplace.com. And this one is actually the specific one for the Shanghai Awards, but it's pretty much the same. You'll come to the same kind of entry. So yeah, Global Healthy Workplace, all in one word, .com, and you're on the website.
Sounds great. Well, I look forward to hearing more about it and figuring out how I can get involved. And thanks so much to all three of you for being here today.
Great. Well, thanks, Michael. I will definitely put you on our mailing list. At least you're informed. So that's a good start.
Thank you very much.
You're very welcome. Thanks for being here, everybody. Take care. Have a great
Thank you, everybody.
Keep warm.